All right. So thank you so much to our presenting states for sharing your unique and innovative approaches to improving the lives of children and families. It's been such a pleasure to work with you and to help bring your vision to life. So we will now hear from state leaders and representatives from governor's offices on how gubernatorial administrations can prioritize children and families at the state level. This panel will be moderated by my colleague, Belle Cuneo, who is a policy analyst on the Children and Families team at NGA and who shepherded states' engagement within this learning cohort. Hand it over to you, Belle.
Thank you, Jordan, and thank you to all of our states that participated. I think these presentations were a really great example of some of the innovative projects and initiatives that have been implemented throughout the cohort to help strengthen communities and families. These states have done some really incredible work over the past 9 months and are leading our country with some really unique and innovative solutions to help strengthen and reimagine child welfare. Each state in the cohort has worked in collaboration with the support of their governor's office to evaluate areas for improvement. We're now going to enter into our time of panel discussion to hear how governors are prioritizing and promoting policies to strengthen children and families at the state level. We have a panel with a wealth of knowledge and loads of important information that they want to share with us today. And we're on a relatively tight time frame to keep on schedule with only 30 minutes. My goal is to shine a spotlight on each of our panelists to hear how their governor is supporting an issue that doesn't typically get much attention. And I'm going to ask each panelist 2 questions. I'm also going to try my best to reserve some time at the end of our panel for participants to ask questions. So please, throughout the presentation or throughout the panel, drop any questions in the chat. And if we don't get the chance to get to it, I will follow up after the session and give you guys responses. Today, we are joined by child welfare policy advisors and leaders who I would like to introduce to you. From Delaware, we're joined by Alonna Berry. From Hawaii, Dakota Anderson. From Kansas, we are joined by Secretary Laura Howard. From Virginia, Chidimma Jenkins. And from West Virginia, we are joined by Michelle Dean. Thank you to all of our panelists for joining us today. Let's go ahead and jump right into our first question. As many of you know, every family that you work with is going to endure its own specific challenges. And the topic of child and family well-being, as we have seen in these presentations, is really a 30,000-foot issue, causing us to evaluate a number of different factors, such as health, safety, stability, and overall strength of a community. I'm curious what some of the first issues are that your governor decided to tackle at the outset of their administration to help strengthen families, and what some of those results were. Chidi, I'm going to start with you. I know that you are wrapping up the end of Governor Northam's administration and probably in a time of much reflection over all of the work that he has done these past 4 years. And so I would like for you to start us off and tell us what are some of those reflections that he has worked on.
Thank you so much, Belle. Yes, it's so nice to be here with you all today. And as you mentioned, we are getting ready to hand off the baton to the Youngkin administration in just a few short weeks here in mid-January. So this is a great time to reflect on where we got started. So I kind of went through the archives and just reminded myself a little bit of some of the things we started off and really prioritized. For those who don't know, Governor Northam is a pediatric neurologist by training and practice. And so he was practicing just before he was inaugurated and elected as governor. His wife, the First Lady, is also an educator, longtime educator, and really knows how education, both of them do, and health come together. And I think it's very important that we highlight that because it really set the initial goals for this administration around health, but also academic, just general, educational success of students and children. But we couldn't do that without taking a 2-gen approach and a whole family approach to all of those efforts. And so we really prioritized maternal health to get us started early on, but also a lot of work around early childhood. And that was the First Lady's platform. So I'll give the quick 1-2 punch on maternal health. Some of the efforts that we really felt like we checked the box on some of them were as a result of a strategic plan that was written. We went on a listing tour of the state throughout the Commonwealth and heard from a lot of our private and public sector advocates and stakeholders. And what came of the report, the plan, and some more recent legislative changes and investments were certifying doulas as community-based partners and members of the medical team. We know that that is a great prevention method for ensuring healthy babies and healthy pregnant and parenting people. We also got Medicaid coverage for their services. And so that was a huge win in our opinion. We also got a postpartum Medicaid benefit for pregnant people, which extended their benefits from 60 days to a year postpartum, which was a huge win, as well as extending or eliminating the 40-quarter rule, which previously did not allow legal permanent residents to be able to be eligible for Medicaid coverage. I could go into everything that we did for early childhood, but I do want to be mindful of time, but just highlight that we were able to, since 2018, double our public pre-K funding to serve a record total of literally more than 25,000 3- and 4-year-olds. And we know that those early learning experiences in those vital first years for a young child prepare them for academic success over a lifetime. So I will go ahead and pass the baton there and let some of my colleagues in other states share a little bit about where they got started as well.
Thanks, Chidi. Dakota, I know that you're also coming up on a similar position, and your governor is really thinking about, throughout his administration, about the legacy that he wants to leave behind and how that's just such a crucial aspect of Hawaii, and want to know what some of those main legacy pieces are that you guys are thinking about as you come into this last year.
Yeah, a big legacy piece for Governor Ige is definitely Ohana Nui, as mentioned in our team's video. So Ohana Nui, or extended family, is our multi-generational or 2-gen cross-disciplinary approach to promoting child and family well-being between the Department of Human Services and the Department of Health. And rather than being a specific program, Ohana Nui is a framework for delivering those services that seeks to break the generational cycles of poverty by concurrently addressing health and human services needs for the entire family. It was started internally within the department in 2016, but was permanently established in statute through Act 82, which Governor signed in 2019, and has already had a significant impact on our child and family well-being landscape. As an example, in conjunction with multiple departments, the state legislature, and various private organizations, we've seen incredible outcomes from our Family Assessment Center one-stop shop, which provides wraparound services for homeless families with the goal to have families placed in supportive or permanent housing within 90 days. Ohana Nui was also a driving force behind the Department of Human Services shift to an integrated enterprise system. This investment in our IT infrastructure paid dividends during the pandemic and allowed the department to stay current on applications for benefits despite significantly increased caseloads. Thank you.
Great, thanks, Dakota. Michelle, I want to turn it over to you now. I think you have a really unique perspective here as being somebody who's seen through multiple different governor's administrations and been in agencies. So what are some of the pieces from your time of Governor Justice's work that you would really highlight that has strengthened children and families?
Sure. So Governor Justice came into office in 2017, and like governors before him and governors that will come after him, he really wanted to focus on improving the child protection system. He really felt that funding for the foster care system was the anchor for that change. And he's really championed funding increases for the system, excuse me, and supported legislation that provided many needed improvements. Early on, some of the legislation that he signed made important strides, such as increasing our foster care subsidies and increasing not only our child protection workforce, but also their salaries and wages to try to reduce some of the burden and burnout on our staff. He's also supported funding for the for the expansion of community-based programs really designed to prevent the foster care placements in the first place. But I think that what is probably most notable is that the support that he has really given us to continue and improve the programs that people like myself, who are the day in, day out child welfare career professionals, believe to be impactful, such as increasing the rates for our state paid kinship care. And this is for families who would otherwise be ineligible for foster care subsidy. And that helps to keep children with their families and preserve that community connectedness and culture. And not only continuing, but expanding our wraparound program even after our federal funding had expired for that program. I think he really saw these opportunities as investments into our state through investing into this service and the system that protects our most vulnerable children.
Awesome, thanks for sharing that. And Secretary Howard, I think that you also have the unique experience of being a leader of an agency and being able to execute your work and the initiatives that Governor Kelly has prioritized. What are some of those things that she has prioritized for you in your time serving as secretary?
Right, thank you. It's also an honor to be here. And I would just want to start out just by thanking NGA just for the chance to have been a part of this cohort, and Casey as well. It was just very, very timely in terms of our work and focus. You know, I have a great privilege in working for Governor Kelly, who brings a real heart for children and families to everything that she does. That's really been true throughout her time in the legislature, and then as she came into the governor's office. So when I think about some of those first issues that the governor prioritized that intersect with our agency, you know, the first does relate to the child protection system, or what we really now want to speak about as the child and family well-being system. You know, when Governor Kelly came into office and I came into this role, we had a foster care system that was pretty overwhelmed. And very, very limited prevention services, very few tools in terms of frameworks for that system. So, you know, we've done a lot of internal work with regard to the foster care system itself, but I really wanted to highlight here the governor's priority on prevention. So the governor very quickly supported enhanced funding for Kansas to be one of the first states to adopt the family first model. And we kind of we plunged right in. And we weren't sure what we were doing, but we plunged right in knowing that we really had very limited prevention options across the state. That's been incredibly successful in the ability to have more community-based partnerships for prevention services, a key factor to what's led to about a 10% reduction in kids entering care for 2 consecutive years. That's been really, really important. The governor has continued to support those prevention and community-based service dollars. I think another area where the governor's priorities have really shined throughout this pandemic has been some of the collaborative work that my agency has done with our Kansas Children's Cabinet and our Department of Health around early childhood support. So we have a kind of an all-in for Kansas Kids project where some really extensive strategic planning happened across the state about the early childhood system. That's really the governor's area of passion. We've had a lot of initiatives in that arena. We've been able to increase reimbursement rates for services, a number of quality initiatives, and some workforce initiatives that are happening right now. We're really excited about the opportunities there. And that early investment and focus on early childhood has really positioned us well to, I think, to make the most effective use of all of the federal child care dollars coming in. We just had finished kind of a 2-year process of kind of creating that strategic plan. So, I mean, I think those would be 2 things I would highlight here at the front end. The things everyone else talks about resonate as well in terms of some of the work we did, but that focus on community-based prevention supports and the focus in early childhood.
Thank you so much, Secretary Howard. Alonna, I think your position kind of states how much of a priority that trauma-informed care is to Governor Carney, and your recent change of position to kind of prioritizing child well-being in a very specific way. So can you speak to some of the priorities that you are working and implementing for Governor Carney?
Sure, thank you so much for having me. I think the headline when talking about kind of the investments of Governor Carney across Delaware, it's really around a collaborative approach. So one of the first executive orders that Governor Carney signed when he came into office was around reinstating his Family Services Cabinet Council, which is really a body designed to bring multiple agencies together to collaborate and solve really challenging social issues, ones that we've all been talking about on this call today, is established to focus on things like workforce, violence in communities, substance use and treatment, reentry, housing, early childhood education, and the school to prison pipeline. And so all of the work in relationship to what the governor is focusing on is connected to the interagency body through the Family Services Cabinet Council. And that work really began the investment that the state has put into a trauma-informed approaches. And so about 3 years ago, the governor signed an executive order around trauma-informed care. And that work really started and has been the basis for the work of this group through the National Governors Association around child and family well-being. And so I'm really excited that we've had the opportunity to collaborate with one another. And I think you'll see from our video that we brought in both partners from community and state agencies and school districts to collaborate collectively towards creating an application for students. And that's just one example of how we've made this investment and collaboration across the state. There have been other projects around a dual generation center, which really put a social services agency within schools and districts across the state. And so here to, really leave you all with this framing around collaboration has been the biggest investment from our governor here in Delaware.
Yeah, great. Thanks for sharing that. And I think an excellent point also of this entire cohort, all of these states just working so collaboratively with different departments and with governor's offices and local stakeholders. It's been cool to bring everyone together to help make progress and get things going. Now that we've been able to lay out the landscape a little bit and hear about your governor's achievements in this cohort and discussed what some of the barriers are that you guys have tackled to help support children and families, I want to know what are some of the things that are next on the horizon. Michelle, I'm going to kick it back to you. I know you were talking a lot about Governor Justice's priority of foster care, and what are some of the next things that he wants to tackle with that?
Sure. So we've been working over the past few years, really focused on expanding the availability of our community-based prevention programs and services preventing removal of children from their homes. And we have a lot of really great innovative programs. And of course, we want to expand these statewide, but even in the communities where they're available, they're underutilized in many situations. And so when we took a look at this, we realized that we didn't really have an effective communication plan to ensure that all of our agencies, across all agencies, all of our stakeholders, the community, our partners, even our own child welfare staff in some cases were aware of not only the availability, but the efficacy of these programs and why they're important to provide service, why it's important to provide services to children in their communities and in their homes whenever possible. So right now we're currently working to develop a written communication plan about serving children, especially with significant and serious emotional disturbances in their homes and communities whenever possible, and what services are available. And we're working collaboratively across our agencies and stakeholders to ensure that we're all speaking the same message and understanding what is available, who it's targeted to serve, and as like I said, as the efficacy of those programs.
Thanks, Michelle. Dakota, as we were discussing, you're focusing on these legacy pieces and coming up on a year of kind of closing things up. What are some of the biggest things that you are trying to get accomplished for Governor Ige?
Well, certainly we're continuing to work to create robust and seamless access to services across all of our agencies. We're very excited to move the proposal developed by the Hawai'i team as part of this cohort, as part of the 2022 admin package. We think that codifying family resource centers in statute and creating a coordinator position will be a big step forward for fostering child and family well-being in the state. Additionally, through the NGA, we've partnered with the nonprofit Research Improving People's Lives to develop an online tool that will help connect job seekers with training and access to resources and benefits for their entire household. At the same time, we want to really be evidence-based in developing our programs and refining our programs. And so the Department of Human Services has partnered with the University of Hawaii for a SNAP longitudinal project to help us better understand the community's SNAP utilization, as well as food security and other nutritional issues that affect the unique populations of our state.
Great, excited to see some of those finishing pieces and things come together, especially with all of our collaborative work together on family resource centers. Some exciting stuff. Secretary Howard, what about you? What's next on the horizon for Governor Kelly?
You know, some of those things are things you've heard from other colleagues here on this call, but I think one of the most important pieces of work that we have launched right now with a partnership with our Kansas Children's Service League has to do with advancing the work of establishing a certified network of family resource centers. We think that's really, really critical work that we really wanted to make great strides on in the coming year. You know, another area has to do with our crisis services and behavioral health continuum. I lead the Children and Families Agency and the Asian and Disability Services Agency that has behavioral health. So we have a lot of cross-agency work going on. And while we were able to stand up mobile youth crisis program this year, we have more work to do to ensure that youth that have significant needs can be served in families in the community. So that's a critical focus. We also want to replicate the work that you heard about in the video in terms of community supporting families, our partnership with school districts. And then the last thing I would say is really gaining more allies in the philanthropic world. I'm working more closely with local governments. You know, we're a state administered human services system, but we think there are more opportunities to work more closely with our counties and cities towards common goals.
Yeah, that's great. I'm definitely hearing a lot of overlap in things, and I feel like you just offered to also be a support in helping with other states that are trying to put together family resource centers. So you piqued my interest there. Chidi, I'll now turn over to you. You are kind of having to think through a transition of administration and how to pass the baton to someone else and how to continue a lot of the momentum and the work that you've been doing and that Governor Northam has been doing. So what are some of those next steps? This looks a little bit different for you guys, but what are those next steps? How are you thinking about that?
Yeah, so luckily, I mean, I'll kick off by, well, actually, let me kick off by saying that we in Virginia really admire Delaware's work around trauma-informed care. For those who don't know, my title is actually Advisor on Childhood Trauma and Resiliency, and it's a specialized role in the governor's office that really works across our different secretariats on the issues of trauma-informed care and resiliency for children and families. But it's housed in HHR, which is why I get to be with you all today. All that being said, you know, I think as we think about the transition that's coming, the reality is that when we look back 4 years ago, the Northam administration, even before I was brought on, didn't campaign on promises. They really campaigned on values, right? And so for the past 4 years, we acted on a lot of those values that were meaningful to the governor and to the first lady, but also the values that were important to Virginians at the time. And so one of those was supporting and prioritizing children and families and their most pressing needs. And it required a trauma-informed lens, and it required an equity lens. And we really felt that we did that tirelessly to ensure that all of our efforts, not just in health, but in education and public safety, in agriculture, because they work on a lot of our food security policy efforts, really that all these child and family agencies made the biggest difference for vulnerable Virginians. And I'll just wrap up by also saying that the campaign slogan was the way forward. So ironically, we're looking to the way forward in this transition. And so as I think about that, and as it pertains to child and family well-being, I would say the one thing I hope they reinstate is our children's cabinet, which was started by the McAuliffe administration. And then we put a spin on it that really prioritized the things that were important to us. So I really think that a similar sort of collective action happen that carries on with that, what I would call a tradition now, will really allow our stakeholders, public and private sectors, to engage with the executive branch and ensure that they're a part of change in the coming months and years.
Definitely. Thanks for sharing. And I think it's really cool that we have two people on this panel that are both focusing for governors on trauma-informed care. I feel like that's a very unique thing, and something that I'm really excited that both of you, your states, have participated in our cohort, and that you guys get to both be on here to talk about. Really, the goal of this is to talk about the importance of promoting children and family well-being, and governors are actively involved and engaging in that. And so thank you for sharing that. Alonna, I want to now finally go over to you and see what some of the next steps are for Governor Carney.
Yeah, so similarly to what I've heard a lot of my colleagues and counterparts from other states say, it's really around enhancing this collaborative approach to address a lot of challenges that COVID-19 unearthed, right? We did some of the groundwork prior to COVID, but really it shed light on a lot of challenges and inequities that exist in our system. And so really thinking strategically about data and data sharing. One of the things that COVID really accelerated was the need for agencies to be able to collaborate better with data and resources in order to solve complex issues. So we have some initiatives centered around that. Additionally, from the project that was created through this program, we piloted it in one school district, our most rural, our largest, one of our most diverse school districts in the state. We want to expand that pilot statewide so that all students can access the resources and tools through their learning management system across the state. We're continuing to invest in our commitment to trauma and trauma-informed care, and really towards a frame of social determinants. We know that students and families across our state have some basic needs that need to be met in order to be successful long-term, and in order to create a better Delaware long-term. And so we have to focus our collaborative approaches, working with labor, working with housing, working with health and social services to solve some of these complex issues. And so we've made some investments in workforce, we've made some investments in technology, broadband, and other initiatives to ensure that we're leaving Delaware in a better place as we transition from this administration. And really, we've built an infrastructure that anyone else can build upon moving forward.
Great, thank you. I am really glad that we have some time at the end. First, just want to thank all of our panelists. I know that I did not give you an easy task of answering all those questions in such a short time frame, but all of you did so wonderful. And now I'm going to open it up to, you're not unmiking or anything for our participants, but please drop questions in the chat if you would like to ask any of our panelists questions. I did receive a question, and whoever wants to, on the panel, wants to speak about it, just go ahead and unmute yourself. It was asking if any state received COVID promoting safe and stable families funds and how their state used those funds. Did any of your states use COVID promoting safe and stable families funds? Okay, so it sounds like we have not. Is there any other questions in the chat that anyone would like to ask? Well, I do have a question. I know someone just asked something about COVID and like what some of those COVID funds are. And as all of you know, it's been crazy throughout the past year and a half to reprioritize how we serve families. But I think more in particular, and what all of the states in this cohort have really focused on, is what kind of opportunities have come out of COVID of how to strengthen child and family well-being. And there's been a lot of silver linings, I guess we could say, in that, of opportunities to reevaluate how things are going. And Alonna, I want to ask you that question, I guess, since you guys have really reprioritized how you're thinking about child abuse prevention and mental health services and connecting people to that. Do you mind addressing that question?
Yeah, of course. I think the main piece is when we think about these things with an equity lens, it's about access, right? That we learned as our cohort went through this experience that there are a ton of great resources and organizations across our state, both public and private, doing really amazing work. But if you talk to, the mother dropping his or her child off at school, they don't always know what those resources are, how they get to them, how do they access them. They don't know which number to call when their child's in crisis. And so what we thought was the best use of our time, given the impact of COVID, given the disconnect between families and schools and providers, in light of just not being able to show up and ask questions in the same way, that it was important that we made all of the resources that exist and we know that work well to support families available to families where they are going. And we spent a lot of time kind of debating, is this a partnership with libraries? Is this a partnership with local community organizations? And I think all those things are still on the table, but the simplest solution that we could come up with was, in Delaware, we use a statewide learning management system so all of our students in school districts opt into and utilize Schoology. They all use the same platform and parents have access to it. So if we can integrate an application into that platform that brings together all of the resources for students and families, that parents and kids can just in one click be able to access those resources, then we would have made a really big impact in terms of making sure that the tools are there for equitable access for everybody across our state. So that was kind of one of the approaches that we used when kind of thinking about access to tools and resources.
Awesome. Thanks for highlighting that. Thank you again to everyone on our panel for joining us today and for making yourself available and your time out of your busy schedules. We really appreciate it. I'm now going to turn it back over to my colleague, Jordan Hines.
All right, so thank you all so much to our presenting states, our panelists, our participants, everyone joining us here today. This has been a fantastic Governor's Summit. We will follow up after the summit with any specific answers to questions that were asked. I know I saw something about effective community-based programs that can reduce placements in foster care. Really happy to also collect some resources for you all on that. And we are also happy to report that a recording will be available on the NGA website. And we are so happy to have the opportunity to spotlight the great work happening in states. We look forward to continuing to support our members, governors, and you all in advancing priorities on child and family well-being. Thank you so much for being here with us today. We appreciate it.